the Lagos State Ministry of Health in Nigeria is upgrading healthcare facilities in a bid to make quality healthcare accessible to all. We are now joined by the Commissioner for Health, Dr. Olajide Idris, to discuss exactly how the state plans to deliver on this mandate. Dr. Idris, thank you so much for joining us. When we talk about upgrading, does this refer to refurbishments of existing facilities, or are we seeing an investment in new infrastructure as well?
Well, it refers to both refurbishment of existing facilities, expansion, and where needed, building outrightly a new one.
And Dr. Idris, where can we see the greatest impact of this upgrade program? How far has it gone to date?
Well, so far we can see the greatest impact at the primary healthcare level. That's one. Then maternal and child health services, and the emergency services, because there we are developing an ambulance service with a view to be getting prepared for emergencies.
Of course, and I think this is a challenge not only to Lagos State, but I guess to maybe Africa widely. We know that we have a rapidly growing population, and in Lagos State, you are seeing a consistent decline in the percentile allocation to public healthcare. Excuse me. So, how are you bridging the declining funds with a rapidly growing population?
Well, you can say declining fund, but our government at least has tried as much as possible to actually increase the budgetary allocation to the health sector. Although it's inadequate, but again, we're trying to rationalize and prioritize. And that's why, with respect to Lagos State, the huge population we have to cater for, and the consequences of this increasing urbanization, we are beginning to see a lot of other problems like chronic diseases, apart from the communicable diseases. So what we are trying to do is now to put more emphasis on health promotion and disease prevention. And that's why we have developed some strategies with respect to outreach programs where we can address the poor, we can target the vulnerables, and the other the needy in the population. So we have programs like the blindness prevention program, the medical missions, screening programs for hypertension, diabetes, cancers. We have public enlightenment for road traffic accidents, etc. The idea is to target the vulnerables, target the key areas, of course, and of course, lay emphasis more on preventive services and health promotion.
Of course, the broad range of initiatives that you're undertaking would be underpinned by a great extent of partnerships as well. To what extent have you seen the private sector coming to the party to partner with the state to roll out this comprehensive intervention that the ministry is rolling out?
Well, there's a policy of government right now to engage private sector in all we do, and this is what we're trying to do in the health sector. Like you do know, the private sector takes care of over 55% of our population here. So there is a definite for us to engage them. We've started engaging them in some services, but there is a huge potential for them. We are doing some, the community health-based insurance scheme program. We are involved in the private sector. There's also opportunity for them to be engaged in service provision, research, health, human development, etc. So many opportunities for them, but we are doing them gradually. But again, the bottom line is that get all of them involved. We have to engage them, create an environment for them, a conducive environment for them for them to operate.
If we tag on, Doctor, to the point you raised about health insurance schemes, from which you're also in partnership with the private sector, this is a relatively difficult concept to sell in any African state. What strategy have you employed to sell the idea of individual contributions to public health care?
Well, we do know that a financing mechanism for the health sector is very essential for for any government. And what we've tried to do was carry out some pilot projects in some specific local government areas involving the private sector. But we've realized that what we've seen so far is that we need to sensitize the people. And from the results from the pilot project we've had, there's a need for us to sensitize the people so that they can understand the need for them to contribute and how to partner with government to be able to carry out our health projects. This we are doing, and that's why we make it a priority. We recently had this State Council on Health meeting, and one of the sub-themes was the healthcare financing. And these are the things that came out, and what we are putting together now is all the input from the various stakeholders, and then we're going to roll out, and a key aspect of that has to be social marketing. We need to market this program to the whole of the populace.
And lastly, Doctor, you have a big program looking at infrastructure development and refurbishment and upgrading. Do you have the workforce to match these facilities?
Well, just like in any country in this region, we can never have the appropriate number of workforce. But what we do have, we are trying to maximally utilize them. And that's why we have programs to train and retrain. We have continuing medical education programs. We are looking at performance evaluation. And also there's this other area we're looking at task shifting and task sharing because of the shortage of this required personnel. These are areas we're working into in respect to human resource for health.